Hi, this video is the art of hair transplant restoration surgery, and this is the design that I have for this client, and he actually flew all the way from Australia. Now, to tell you the truth, I have quite a bit of a, at least twice a month I have a client from Australia, from England, once a month from England, and then from France, from all around the world. The most important thing is when the client come over, they don't fly for price and all this stuff. It's the whole artistry of creating hairline, and you want to make sure that the hairlines look so natural that when you sit in front of people that no one know you have had surgery. And what we draw is one thing, it looks simple, but when we really do the surgery, make the whole, there's a lot more depth into the hairline. But just a general rule of thumb for Caucasian, this client, from the mid eyebrow to the hairline, on average is around 7.5 to 8.5 centimeter for Caucasian, and the Asian is around 6.5 to 7, and so black. For I venture to guess his is around 7. Let me take a look. My gosh, it is exactly 7. Again, we first, I base on the anatomy of the face. I don't just do and measure first. We measure after we draw the hairline, after we look at overall this how proportional to the face, and then we look at the landmark on the head and where the highest crease and then slightly above that, and we follow, and the no hairline straight across, as it had to dip down the front and flow sideways. And then again, for his, if you look on the side view, there's his angled temple, called edges, or his point is too steep backward, and so we kind of slightly raise it up, because if we don't bring in the temple again, you're gonna have a low hairline but really wide forehead, and then you say, yeah, you have hairline, but it draw attention because it's not proportional. And again, you don't want to do hairline too high, you don't want to do hairline too low, you want to be all proportional. And then same thing, you don't want to do too wide. You from the mid eyebrow to the hairline, so around 7 to 9 centimeter max. And this client's roughly around 8 centimeters, somewhere around there. So he fall within range. It's just he's naturally born with a little bit below average height of hairline for Caucasian. Again, not everybody gonna fall within the bell curve of the 7.5 to 8.5. Some of them, like his, is 7 centimeter. And again, and then once we get the shape down, we transplant at 35-45 in the front, changes when we go backward, and on the side is flat and pointed backward. And then not just the angle is important, the selection of hair graft important. We transplant rows and rows, single hair graft in the front, followed by root to go 2 hair, 3 hair, 4 hair, and the back for bulk and volume. Now, there's the other important factor is the type of hairline, and it's all depending on your personality too, and I can cater around it. There's 4 different type of hairline. You call a soft hairline and a tight hairline. Those are the 2 extreme. The soft hairline has a bigger zigzag, and I'm very into the zigzag, and I mentioned that for like over a decade. The bigger zigzag with a soft hairline, that means we use a lot of single hair roots in the front, more than average, and it will give more a natural look. It doesn't draw attention to you, but the downside is because the thick root is further away from the front of the hairline, so then the density look a little bit less dense, but it's still going to look good. So that's conservative personality. And then on the other extreme, they call it the tight hairline, and those are more for client with more like celebrity. They opt for that. And why? Because a lot of celebrities say, hey, look at me, look at my hairline. I'm very youthful, I'm very handsome, and it's so do you have a smaller, tighter zigzag? And what that does is the thicker roots is more toward the front, and we use a lot of single hair root too, but it's less than the soft hairline. So then that leads us to a more tighter and more dense look. However, sometimes with tight hairline, it can draw attention a little bit. It's still going to look natural, but it draw a little bit more attention. So that leads us to somewhere in between, and that's where most client offer. They call it medium hairline. So medium hairline has a medium zigzag, and they say, hey, you know what, I like some density, yet I don't want to draw attention to myself, so they have a medium hairline. And then there's somewhere in between the medium and the tight, they call medium tight. And what it is the zigzag is a little bit smaller than the medium, but it's still bigger than the tight. And again, they want to reach for the maximum of density and yet not draw much attention. And that's getting very popular nowadays. And again, it's all depending on your personality, and you can always convey that to me during the surgery day, and then we go from there. So this is the art of a hair transplant restoration surgery on a client who flew in all the way from Australia. Thank you.